Welcome back to the Caregivers Podcast, everyone. I'm your host, Dr. Mark Ropeleski, and you can call me Dr. Mark. When PTSD hits home, your response can make it worse, even if you're trying to help. Dr. Shaili Jain, psychiatrist and clinical professor of psychiatry at Stanford University, is going to give caregivers a playbook today for the first 30 seconds, the language that de-escalates, and the boundaries that protect you too. Dr. Jain, welcome to the Caregivers Podcast. We're so happy you're here with us today. Dr. Shaili Jain, welcome to the Caregivers Podcast. We're so happy you're here. Let's jump right in. So in the first 30 seconds, when a person you're caring for who has PTSD and is starting to get triggered and that starts taking over, what should you prioritize to de-escalate for their nervous system?
So in those first 30 seconds, the most important thing is to regulate yourself first. So lowering your voice, slowing your breathing, reducing words, decreasing stimulation in the environment, and just offering orienting cues. So you're here, you're safe, I'm right here. Phrases short, succinct, that just ground the person who's been triggered in the moment. And, things that aren't so helpful is, using logic, arguing facts, asking for explanations, touching without consent might not be a good idea either when somebody's been triggered. Phrases like calm down are not particularly helpful. So regulating yourself is the most important thing you can do, I think.
I imagine that takes some practice.
Absolutely. I think you've got to start by recognizing when you yourself are dysregulated and start recognizing your own responses. It's really natural when you're observing someone who's triggered. It's really natural, obviously, for your own fight or flight to kick in and for your own reactions of fear and anger and anxiety to go up. So I think just learning how to regulate yourself, um, you know, uh, pattern recognition from how you might have responded in the past and how to correct that. But you're right, it is a practice. It's absolutely a practice.
So what's the most common thing that a caregiver does in a moment like that might be well-intended, but that actually results in escalation of the moment as opposed to de-escalation of the moment?
I think maybe overstepping, maybe trying to fix things, maybe trying to, use logic or offer some kind of explanation or insight. Um, I think that's a common mistake. And I feel like, focusing on safety first, lowering the threat level, de-escalation, creating a calm environment, a quiet environment, that's a much better approach.
I hear you loud and clear. We're so inclined to want to fix it in the moment, but perhaps that might be the biggest sort of kicker off of a process that might result in more harm. So in that triggered state when it happens, what's the person with PTSD actually not capable of hearing or not capable of processing or doing, even if they want to or in that moment? What do we need to understand?
So essentially in the PTSD brain, especially when someone living with PTSD is triggered, they have, I think best analogy is kind of like having a hypersensitive alarm system. If you have like a house alarm or a fire alarm and it just gets triggered a little too easily, so that region, that brain, the area of our brain that detects threat, in particular the amygdala, that detects danger, that is easily triggered. A lot of times people with PTSD, they see danger where danger does not exist. Stress hormones flood their body, their heart rate increases, their muscles tighten, and the thinking part of the brain, the frontal lobe, it goes kind of partially offline. So bearing that in mind, what is hard for them to do is process complicated instructions, use a lot of logic. Um, they're not able to have perspective, right? When you're not triggered, one of the most common rationalizations human beings is we try and use perspective, right? It could be worse. It's not that bad. When someone's triggered, just the very nature of what's going on in their brain, in their neurologically and chemically, they're not able to take perspective. They're not able to listen in a sophisticated manner. So you can't debate somebody out of a body state, and that's just something I always try and bear in mind, especially in my own clinical work when you're dealing with people who have been triggered or traumatized.
So what I'm hearing here is an important sort of conversation between the frontal lobes or the prefrontal cortex and the amygdala, and that's sort of a very important interplay. Can we maybe review that a little bit for our listeners? Because not everyone may be familiar with it, but can you just start by telling us about the amygdala and then its actual relationship with the prefrontal cortex and where things go awry?
Yeah, so like I say, amygdala is kind of where those big emotions are processed: anger, fear, where you detect threats. It's a very kind of, you know,
So it's an ancient part of the brain.
ancient part of the brain, and we need it, right? If you need it to be aware of your have situational awareness, to be able to track your environment. It's vital. But imagine if it was overacting, right? Overly active. Imagine if it was, um, you know. Like I said, seeing danger where danger doesn't exist, misinterpreting signals around. And there is that complex relationship between the frontal lobe of the brain. The frontal lobe of the brain is where we kind of use judgment, where we plan, where we execute, that kind of thinking, planning part of the brain. And there is that relationship that when the primitive part of the brain takes over, the frontal lobe takes a backseat. So again, behaving logically, behaving rationally, planning, execution, that takes a backseat when the amygdala takes over. So that's the ultimate dilemma with people who have PTSD, that the amygdala is kind of front and center. And when that gets triggered, it sets off a whole cascade of reactions in the brain, which impact the body, which, like I said, like flooding the body with noradrenaline, adrenaline, all of that classic fight or flight response.
Mm-hmm.
And that's really what people who are living with untreated PTSD are dealing with on a day-to-day basis, because they don't know what is triggering them. They just are triggered, and so they are living in that kind of fight or flight response. And the thinking, planning part of the brain, the frontal lobe, is just not getting its due. And the amygdala response is really what's predominant.
Yeah. Are individuals who suffer from PTSD prone from earlier life experiences to have that disconnect of communication between the amygdala and the frontal cortex? Or is that actually something that's primed and an event associated with that actual traumatic event?
So PTSD is a highly heritable condition,
Mm-hmm.
So it, it's a little bit of a maybe it's hard to imagine this, because the very nature of that phrase, PTSD, post-traumatic stress, it implies that you're perfectly fine and then you have a traumatic event and then you're not fine. But actually, it's a very heritable condition. About a third of people have
Mm-hmm.
this predisposition, this vulnerability, that after they're exposed to a traumatic event during the course of their life, their body and their brain will react in a way that is more predisposed to them developing PTSD. Whereas another person who doesn't have that heritability could go through the same traumatic event and not have that response. So I do think there is a genetic component in the way that we are wired in our neuroanatomy that makes some people vulnerable. But to your point, early adversity or early trauma totally sets people up for developing full-blown PTSD.
So childhood trauma and those
Totally,
kind of events.
absolutely. Because to me, it's that analogy. It's the straw that broke the camel's back, right? Somebody could be exposed to trauma at 5, 6 different times earlier on in their life, and they could respond perfectly fine, and they could recover and heal, as the vast majority of human beings do. We are definitely wired for resiliency. But then you just need that last event, and then that's it. The straw that broke the camel's back, and then you have a full-blown PTSD response that is no doubt influenced by what came earlier, even if it didn't show itself then.
Okay, so if I understand correctly, and for someone who does not understand PTSD, what's actually happening in the brain and body when that triggering occurs, to the point that even being in your own home with the person you love, who might be your caregiver, none of that feels safe anymore? Is there a point of no return, or is it just the sum effect of all of those sensations?
I think it would depend on the degree to which you're being triggered. There's definitely like a gradient, So let me give an example. let's say if you're somebody who, when you were young, you survived a deadly house fire, right?
Hmm.
Um, and you were very young and you kind of got on with your life and everything was okay. And then now you live in California and every year there's a wildfire season. It could be on a good day, just the smell of the smoke in the air, even if you are not living in a community that has been directly impacted, even if you're like 100 miles away from a fire that's burning, just the smell of smoke in the air will just kind of have you feeling sad, on edge, jumpy, irritable. So that's kind of one extreme. And then when you're fully triggered, maybe if you uh, are closer to the fire, or if you see some footage or, online, or if, um, uh, somehow you're triggered in a way that you're fully triggered and you're having a full blown triggering event, that's when you're almost disconnected from your environment. The present environment you're in, whether you're in your home, whether you're with your family, you're actually not there anymore. You're kind of taken to the past. That's the way I like to see it. And then the past
Hmm.
becomes more important than the present. And that's when you have a full body triggering response, kind of like what we talked about with the amygdala takes over. Part of that triggering response might involve a full blown flashback where there might be a level of dissociation. And then where you are really doesn't matter. And if people around you can ground you in the present and get you back to the present, that can be incredibly helpful. So I would say there's a spectrum of responses
Hmm.
to trauma and being triggered. And I think the key is for someone who's living with PTSD, what helps you go from being untreated to treating is just much more awareness of what is triggering you. So you can be one step ahead of it so it doesn't get to that point where you are totally disconnected from your presence, because that's very hard to come back from.
And that's what you refer to in your book about the explicit and the implicit sort of triggers of those exacerbations.
Yes, absolutely. And I think making the implicit more explicit, that's the work of treatment, so that you can be
Hmm.
back in charge and recognize those triggers. And what I find really cool as a clinician to see when someone has gotten treatment or is treated is they can almost predict. They're like, okay, so Sunday we're going to this big concert. And I know that seeing all these people or being in an environment where I don't have an exit strategy, this is going to be upsetting for me. And this is what I'm going to do to take into account. So then again, putting that planning part of your brain in the front seat, because you have that knowledge now of what's triggering for you. So you can go about your life and live your life. That is the work of treatment. And that's what I feel like is so empowering about getting treatment for PTSD.
Yeah, that word empowering is just monumental. And like to hear that individuals can achieve that level of foresight and control and be able to go back to enjoying outings is tremendous.
Mm-hmm.
So, as a caregiver now, from that lens, over months and years of caregiving for someone with PTSD, what can actually happen to a caregiver's nervous system when they're always scanning or sort of anticipating or having to adjust their tone or trying to prevent or trigger themselves in someone else's PTSD episode?
Mm-hmm.
Do caregivers' brains get rewired too?
Oh, absolutely. I mean, your worst case scenario, if you have years and months, which unfortunately happens all the time, you know, months and years of living with someone, loving someone with PTSD. And if you spend that, the best phrase I have to describe it is like walking on eggshells, right? Because you're tiptoeing around your loved ones' moods, anger, inflexibility, avoidance. That is one of the worst scenarios I think you can be in, because it's the worst scenario is when you develop vicarious trauma, when you become traumatized yourself by loving someone. Um, on the other
It,
extreme, obviously, minor discomfort, anxiety, stress would probably be the other extreme. But yeah, it is not easy to love someone who's living with PTSD. Let's be clear about that. Um, to support someone and love someone with PTSD is, um, it's a tremendous effort. What I do like, though, what I'm seeing now, Mark, which I think is really, really hopeful, is I do think there was a generation and a time when it was just kind of expected that people go above and beyond. and that was just their lot in life when they loved someone with PTSD, and they had to put up with a lot to the point where they made themselves unwell. I do think that's changing. I do think we have a new vernacular, a new language, and a new approach driven by science, driven by what we know about the science of PTSD, that is really empowering loved ones to navigate that relationship in a much more healthy way.
Well,
So it
and that
doesn't have to
parallels
get
a
to
lot
that
of
point.
changes in our society,
Yeah.
and that individuals, I think more often than not in those cases, for historically at least, it was women who are caregiving to a man with PTSD, and their voices are certainly louder than ever before, and want to be heard. Can you tell me a little bit more about the science of that, how that new voice and conversation is translating into benefits for the caregiver?
Yeah, well, what I loved was there was some randomized controlled trials done by some amazing Canadian researchers who specifically did couples work, right, in PTSD. And what we saw was that the aim of the game, I mean, I'll kind of reduce it to a quick sentence, but the aim of the game should be that a couple or a dyad should learn to cope with the symptoms together, in an empowering, healthy way. This walking on eggshells, tiptoeing around, or letting PTSD set the agenda for the household, that is incredibly unhealthy, and that contributes to what we have seen, certainly in the veteran population, where divorce rates are really high with people with PTSD, with comorbid substance abuse, and intimate partner violence can be really high too. You know, that really set the tone. It was a JAMA article that was published several years ago now, but I think that set the tone for what was happening in clinical practice, where, like you said, very, very good point. A lot of times it was women who were put in that role, and we tend to expect that women go above and beyond in caregiver roles. We tend to just assume that that's what they're born to do, and that being in this kind of sacrificing position is, makes them really happy, and that's what they want to do. But of course, that's not right at all. People who are overburdened caregivers do not take care of themselves, and nothing good comes of not taking care of yourself. So I think that was what the thrust of the science was, that couples, or if you love someone with PTSD, no matter what your relationship is you have to learn to cope with the symptoms together. So, for example, textbook example that comes to mind all the time, people who live with PTSD, a lot of times, depending on the nature of the trauma, they will avoid stuff. They don't want to go to the mall. They don't want to go out to big party events. They don't want to go to big, like graduations or celebrations. Generally, they're hypervigilant. They're not comfortable in crowds. So what starts to happen is the home becomes organized around preventing triggers. So everybody's life becomes constricted and narrowed. And that's like the most tragic, sad thing. Imagine not just a spouse, but kids. Everyone's living their life in this narrow, constricted way just so that the person with PTSD doesn't get triggered. So coping with the symptoms together in a healthy way. So again, we have this event coming up. It's a family event. We are all going to show up. How are we going to do this? Right? More changing the narrative, so one person isn't overburdened and overly responsible for another person's symptoms.
You said the word we, and I think that really resonates, because it's not about what each individual is going to do for themselves, but there's that relational aspect that it's actually putting the relationship first. And how are we going to allow this relationship to thrive with our mutual conversation and both people's input into how it's going to move forward? So I think that's wonderful. Getting back to that trauma lens, though, there's that sort of, when a caregiver is facing that constant anticipation, what does that do to their attention span, to their sleep, to their own caregiver's body stress response? I mean, can you get almost like a secondary PTSD from caregiving?
Yeah, absolutely. We call it vicarious traumatization, because
Vicarious traumatization. Okay.
hurt people, right? And the reality is sometimes people living with PTSD can themselves use words or behave in ways that are traumatizing to other people. Again, no one's doing this intentionally. It's just part of the pathology of the condition. It's infectious. Trauma is infectious, right? So it can totally infiltrate into a caregiver's life through this vicarious traumatization. So you can develop, low-grade symptoms of PTSD, depending on what it is that you are exposed to. You can develop low-grade symptoms of PTSD yourself, just like we said before. You can be triggered. You can have disrupted sleep. You can start to have nightmares. And then if you combine that with not taking care of yourself in the way that we know everyone should be, by getting adequate sleep, by having healthy nutrition, by exercising regularly, when you go full on into that caregiver role, I think that combination can be really potentially very problematic.
Mm. And, we learn so much these days about the importance of setting boundaries, but I could see in that dynamic where if the caregiver tried to really reinforce boundaries, it may not actually work very well. Do you agree?
Oh, totally. But I think it depends. It depends on many, many factors. Like I said, part of what was encouraging to me is I've definitely seen in this era of social media a new vernacular emerge that has become widely available to people from all walks of life. Just that word boundaries, right? Like, I don't know, when you or I were growing up, I'm not sure that was a word that was known what it is, but I think nowadays pretty much everybody knows what that word means. And it just gives you agency to know that you can be your own person and you can say yes and no to what feels right or wrong to you. So I think that's a very important concept. I think what we need to pay attention to is what are caregivers coming into the dynamic with, right? As physicians, what makes people sign up to be a doctor, right? There might be some obvious reasons, but I think a lot of us, certainly in my experience, the best doctors I've met throughout my career, which is like a 25-year career, they were caregivers well before they got their medical diploma. There
Guilty
you
as
go, in
charged.
some way or another, right? Right. So I think it's important to be curious about the caregiver. What's their background? Who were they caregiving for before they ended up in this scenario? What's their trauma exposure history? And because that I think explains a lot of the dynamic in that dyad. Whereas let's say if you had somebody who didn't grow up being a caregiver, who didn't grow up being a fixer, who didn't have a large part of their identity tied up in being a health healer and making people better, maybe they're naturally going to have more boundaries going into it. And then having boundaries sets the tone for the relationship. I think what's really hard is if people have been in a relationship for years, maybe decades, and then the caregiver starts to change their reaction and responses. That's when it's really difficult. But I think if early on, there's a language that kind of sets healthy boundaries about what can be done and what can't be done, that can be really, really helpful, I think, in the overall trajectory of that caregiving relationship. So as you can probably tell, it's really complicated and nuanced. Everybody is bringing their own.
We're all individuals, right?
Yeah, people are infinitely complex, right? Human beings are infinitely complex. So, but I gotta emphasize though, there is a societal context that really plays a role. Like I said, I think what was acceptable 20, 30, 40 years ago is not acceptable now. And it's because as a society, we have said it's not acceptable. And I think that really helps an individual caregiver set healthier limits and boundaries about what they're willing to accept and what is not acceptable in that relationship.
There's so much potential for prevention in terms of even preventive mental health care. God only knows we have trouble accessing it when illness is set in, but that whole notion of preparation for caregiving in all of its facets, there's so much we can learn about ourselves and the role we're about to assume by some very sort of didactic thinking about what do I bring to the relationship as I embark on this journey caregiving.
Yeah. Right. Right. Which is why it's so important, as you know, for caregivers to have their own support system for exactly that reason.
So what is the quiet thing that a partner's PTSD just quietly steals from a caregiver, even in a relationship where there's love and nobody's really trying to hurt anyone, but what's taken away subtly?
I think predictability is taken away, because of the chaos associated with PTSD. So I think predictability rhythm, peace, all those things that you need to thrive and enjoy life, right? I mean, what should life be about? Like I always tell my patients, life isn't just about surviving. You want to be thriving, right? And so PTSD definitely steals that predictability, the day to day kind of rhythm, the day to day safety that is necessary for creativity to flourish, for people to flourish. Homes become organized around preventing triggers instead of living. And it's actually amazing how subtly that can happen over time in subtle ways. Um, so again, avoidance is a core feature of PTSD. It's actually one of the symptom clusters if you look at the DSM-5 diagnosis of PTSD.
Hmm.
And that avoidance of living life to the full, that can spread. People's plans shrink, their ambitions shrink. All they're doing is looking around for threat. Like I said, that classic walking on eggshells. And I definitely think in this era of digital online social media, where it's very easy for people to live in their own echo chambers and to find exactly their version of what their perception is of what the world is, that can become really intense, really, really fast. So I think that's really what PTSD steals potential, right? And not just for the caregiver, for anybody else who's in that home, particularly children.
Well, we count on those on certain anchors that allow us to just stabilize, or things that are predictable that with the flurry of inputs that life gives us today, we know are there, that we can just sort of assign and categorize different things to deal with now and later. But when none of those can predictably exist, I can see where the household just sort of becomes on edge.
Yeah.
When you're doing that arranging of your life around the person with PTSD so they don't get triggered, how do you know anymore? Like, what actually supports healing versus what just keeps reinforcing the PTSD?
So,
Do we lose track of that?
well, again, it depends. If you've been doing it for years and years and years, it's like any other practice. You may not be able to see the wood from the trees.
Hmm.
But I think certain patterns show that even if it's well intended, you may have made some missteps. So over accommodation, right? We all want to be accommodating of the people that we love, but there's a subtle line between accommodation and over accommodation, you know? And in my mind, here's how I know when I'm over accommodating: when it's coming at the expense of my own self care, when I am losing oxygen because someone else
Hmm.
is sucking up a little bit too much. So over accommodation, canceling everything, avoiding every stressor, shielding the loved one from life. I think that's a sign that you have overstepped. It feels like love, but really it's reinforcing the PTSD mindset that there's danger everywhere. That's a pathological mindset. It's the nature of PTSD. It's the hypervigilance of PTSD. So if you over accommodate, you're reinforcing that inadvertently. Of course, no one is doing this on purpose, but that's what happens. So what should replace it? Gradual, supported engagement with the world. Like I said, we are going to go to that family event. If you want to go for half the time, but I'm going to stay the whole time, that's up to you. But we're going, we're showing up as a family together. We can go early on before all the other guests are there, but we are going. Small exposures, shared confidence, sending out a message that we can handle this together. That might be a healthier approach as opposed to the over accommodation that I talked about earlier.
So, what would be the first thing that a caregiver could realistically anticipate as a positive outcome in that direction to eventually being able to go out as a family and participate as a couple in the outside world? Like, what are the first signs that you're heading in the right direction?
I think less chaos, right? Less triggering. So let's say you make that, you go to that family party and you've decided beforehand that, you're all going to show up together. Exit strategy available for the person who's acutely suffering, but you're going to enjoy that time because you need that time. And I think if it goes according to plan, so a predictable tone, a predictable routine, I think that's success. Because what is PTSD? PTSD is chaos, right? It's arguments, it's family events gone wrong, it's plans that have, just fallen apart. So I think predictability, tone and routine, you know, vocalizing what the boundaries are. So, for example, in this case, the boundary might be I am staying because I want to spend time with my family. If you choose to go home early, that's totally fine. And then being able to, having had that happen and not have that be overridden and everybody ends up going home early. And then, I think that kind of communication about emotional validation, like checking in with people, where are you at? And that can be bi-directional, by the way. It doesn't just have to be the caregiver. It can
I
be
agree.
the person with PTSD checking in with that person too. But I think to me, when things are going right, it's when there's less chaos and there's more predictability and there's more peace. And it might not be perfect, it might be messy, and I think messy is okay. But I think when there's less chaos, you're going in the right direction. And the other thing I tell people is improvement isn't linear, right? You might have a couple steps back, but as long as overall your trajectory is heading in a positive direction, you have to celebrate those small wins.
Celebrate and be patient.
Yeah.
I could see where it would really get murky if at the first sign of discomfort and one individual needed to leave, that the other individual just packs up and leaves with them. Like that could really just reinforce the behavior. And I really like how you sort of spoke of the fact, well, here's our out strategy, but I'm going to stay back because I haven't seen our friends in a long time. And it's okay that you've had enough and you need to leave, but I'm going to stay. And I could see how healthy that can be for the caregiver in so many circumstances.
Absolutely. And also think about it. PTSD isolates people. And when the caregiver becomes isolated too, I mean, there's only so many events that you're going to get invited to. And if you're leaving prematurely or not showing up for the people, you're going to stop getting invitations. That
You
is the reality
starve.
of life. Your own social network is going to shrink. So this is actually vital, right? That you are also tapping into your own social networks and keeping those alive, because social support is one of the biggest predictors of how people heal from trauma. Having an intact
Absolutely.
social support network is absolutely vital. So I think there are on so many levels, that's why that is important, you know, to have that clear expectation that I understand this might not be your cup of tea right now, but it's really important for me. So how do we figure this out?
It's a really important conversation. It's something struck me before that, I know that after the initial traumatic event, we all process and have to do some acute processing, but it's then in the secondary and tertiary phases where some of the real PTSD can set in. But when we get to that point where the caregiver is very enmeshed in that sequence of caring, I know that for patients with PTSD, they benefit from cognitive behavioral therapy. But what I was hearing from what you were telling me is that caregivers probably need to be cognitively accountable also. And they might actually benefit from some cognitive reframing and eliminating some thinking errors and other things if they're going to be able to show up not only for the person they're taking care of, but for themselves. And cognitive traps could really alienate them from achieving that balance. What are your thoughts about that?
I would say that if you are going to be in a long-term relationship with someone who's living with PTSD, who still has untreated PTSD, I think having your own support network, whether it's informal, like peer support, or maybe through other people who are going through a similar thing, or whether it's formal support, formal mental health treatment support with a qualified therapist, that's almost vital. I think it's really murky territory to try and figure all that out yourself in real time. you
It's
know?
so complex. Hmm.
Yeah, like you say, I think you could get in too deep without even realizing it. And then it's just really hard to get out. So I would encourage anybody who is going to embark on that to make sure they are getting their own help. And then speaking to what you were saying about lack of access to mental health resources and stuff, the good news is nowadays there's some excellent resources just available online. Sometimes I think people just need a bit of education and they need some phrases and they need a way of naming these things. I'm a really big believer in that phrase, name it to tame it. Sometimes just just being able to describe what you're feeling and know that other people feel the same and there's a name for it can do so much to empower you to take care of yourself. So I think there's plenty out there, but absolutely you need your own resources to be able to embark on that relationship and not get pulled in. You don't want to get to that point where you've crossed into control and where your anxiety is driving decisions, and then that's not a collaborative relationship. You're not partnering there. You've got into this situation where the relationship has been controlling in an unhealthy way.
I could think that you get to that point as a caregiver where you're monitoring everything, you're hyper vigilant, you're trying to help, but you're actually just almost becoming the police or the managerial driver of everything in the environment, trying to just manage the relationship with the individual with PTSD. Where can that actually really start making things worse? Like, is there a point where it can just explode?
Well, I think it can definitely end up in resentment, right? And
Mhm.
resentment is not good. Resentment leads to bitterness. It leads to relationship breakdown. It leads to all sorts of unhealthy mental health outcomes. So I think resentment is it's a red flag sign, right? Um,
Absolutely.
Infantilization is another one, right? Where you literally start caregiving becomes the predominant, role. This isn't a relationship between two human beings anymore. It's literally you are the consummate caregiver, and so then that leads to a loss of the intimacy and the other things that you might have been getting out of the relationship. Um, and then I think when you get too controlling, it really erodes the trust bidirectionally as well. So there's a lot of things that can come undone. Um, when you're in it too much, and that's speaking to what I was saying before. Like I said, we have documented divorce rates in people who live with PTSD. It's really, really high compared to the general population. So I think relationship breakdown is almost inevitable in some fashion if we're not paying attention to these early warning signs.
Sure. We're going to take a break, folks. We'll be right back. Fred and Graham, any questions from the production team?
We've been talking about different triggers. Like you used the example of the forest fire and smelling the smoke, and that taking someone out of the present moment. So just curious, like what happens if the primary caregiver, and a lot of people are relying on just one person, what happens if the primary caregiver was present or involved in the original trauma event? So that, you're looking at this person that is trying to look after you, but they continue, just their presence can bring you back to the moment where sort of the PTSD was originally formed, if that makes sense.
Mm-hmm. They're part of that memory. You mean they're part of that traumatic memory?
Right.
Yeah. Yeah. So it's really messy because I think a lot of it depends on the survivor's cognitive interpretation of that person's in that moment, right? So let's say you're a couple and you're walking down the street and you get violently attacked and mugged, and if in that traumatic incident the person who was most traumatized perceived their partner as being unhelpful or abandoning them or did not show up for them the way they expected, obviously that's going to be interpreted in a totally different way than if they were the heroic savior and, were pivotal in them, getting to survive the event. But these are really complicated things, right? Because there's a lot of guilt around this. There's a lot of pent-up anger. I mean, it really needs to be processed. And I don't believe it can be processed. People can't process this just for themselves. They need a qualified mental health professional to really break this down, because you might not be totally aware that you're walking around with all that resentment. So then when you get triggered, that's why you're so angry with your partner, but you don't quite understand why you're angry. But it's because you have this cognitive distortion from the past that, my partner should have helped me there. Whereas the reality is when you get randomly assaulted on the street, everyone is going to have all sorts of reactions. And So there needs to be a very intentional process of what went on and some healing from that. I mean, I think any one of us could react in suboptimal ways faced with a traumatic situation. You want to have the opportunity to be able to make amends for that or express your regret over that and then to move on from that. But if it continues to go unchecked, then it's going to show up in any subsequent trigger responses. And it's almost like it just gets worse and worse. I mean, you could see how this could, build up into something built on a foundation of unrealistic expectations, Um, so, so like I say, I don't think this is something people can figure out by themselves. They need a qualified mental health professional to help direct them through it.
Just another question. One of the words that you referenced recently on your social media content was this word, kinkeeping. And when I heard your explanation for that, I immediately started thinking about how this sort of defines the classic caregiver. Could you explain to us what kinkeeping means and how that sort of might apply to caregiving?
Yes, so kinkeeping is that classic work. It's a lot of invisible work, which historically, let's face it, has been done throughout the centuries, mostly by women. And I would argue, as a social psychiatrist, that the very reason it's been done mostly by women is why it's totally unvalued and it's invisible work. But it is the work of keeping communities and families glued together. So the gentle nudges, the reminders for communication, checking in with people who've just had a surgery, bringing people together to celebrate good times, bringing people together to celebrate holidays, organizing, creating opportunities for literally kinship, right? This is such a vital activity, kinkeeping. It really makes me very sad and frustrated how ignored it has been throughout the centuries. And I think we are living in a time when kinkeeping is under attack, because basically what's happened is women have had access to a lot more opportunities, a lot more education. A lot of women have just decided, I'm not doing this anymore because it's thankless work. And guess what we have now? We are living in a loneliness epidemic, right? And loneliness is having a massive toll on the mental health and the physical health of populations, especially as they age. So to me, kinkeeping is that act of love and caregiving. And it is a vital activity. But until as a society we give it a name and we honor it, and usually in the world we live in, the way you honor it is it's not unpaid labor, right? But I mean, I think it's always probably going to be unpaid labor, but we need to honor the people who are doing that work, just the way we need to honor caregivers. Then I think it gets the status that it deserves. So when people do that work, it's appreciated more, it's respected more, you understand how it's enhancing your life more. And then I think the person who's doing it has more longevity in that role. They don't burn out. I'm a big fan of distributing kinkeeping more, making sure everybody's doing their bit, raising our children so they recognize the value of it, you know, raising our boys the same way we raise our girls so that everybody's doing their bit. I think it makes for a much healthier society. I think it will lead to a lot less mental health conditions. But I think that's how it basically ties into caregiving, the same way caregiving is unacknowledged, unpaid, um, increasingly complex in this day and age too, right? I think it's the same for kinkeeping. So I hope that answered your question. You got me started on a topic that's very close to.
That's really cool. And it's interesting is that we're naming kinkeeping,
yes.
But what we need to do as perhaps the family, but even on the grander scheme, the community or society, is name the value of kinkeeping, not just naming the act of it, but really digging deep and naming the rich value that comes from kinkeeping.
Yeah.
And
which is historically, it hasn't had that value. And again, I think that's tied in with who was doing the work, but let's name it. It's really valuable work. Let's make this invisible labor visible so we can see what it's doing as this very therapeutic glue that ties us all together, So yeah.
You mentioned it's gendered, which is interesting, but just beyond sort of having majority women in these roles, it's interesting to see who in the family if there's multiple, say, daughters in the family, it's interesting to see which one of those people gets slotted into that role and how that sort of comes together. Because there's all kinds of dynamics, obviously, that are involved in that. But there's one person that sort of always gets sort of the worst job if you're looking at it as a negative.
Well, yeah, and I think what's sad about kinkeeping is it's actually a great job, right? It's when people don't appreciate it that it starts to become, it's the same with caregiving. As you know, there is a robust literature that shows when people are caregiving, it's really good for them too. It can be really good and rewarding for them too. But when does it stop become rewarding? When does it start to become associated with burnout and mental health conditions? A lot of time when A, the burden is too much, or B, they're not appreciated. They're not getting anything out of it. And actually, their vulnerability is actually exposing them to being mistreated. That's when it's a problem, And definitely when we live in a culture and a society where everyone is wearing a lot of different hats and there's a lot of competing demands on our time, I think in more traditional societies and traditional cultures, the eldest daughter took over the kinkeeping, but there was time for her to do that because that was a job, if you would like. But clearly we're living in a world which that is more rare, and it could just be people are rejecting those roles because it doesn't really fit in with who they are intrinsically as people. So many reasons, but you're right. I think the crux is, why don't we just name it that it's really, really valuable? And anybody in your life who is a kinkeeper, you need to be telling them, showing them how much you appreciate what they're doing. We all have a role to play.
I think that segues nicely into the next phase. So welcome back, everybody, from the break. We're here with Dr. Shaili Jain, professor of psychiatry at Stanford. Dr. Jain, when the person you're caring for is shut down and defensive after a moment where their PTSD gets activated, what's the cleanest way you can actually ask for a conversation with them, to re-engage with them without actually triggering shame or resentment?
You have to be feeling okay too, right? So if something very unpleasant went down, if you were part of something that was very hard, when you're ready, just anything that lowers the defensiveness. So a phrase might be, is this a good time for us to talk about something that was hard for both of us, right? I'm not here to blame you. I just want us to feel safe together, right? Some phrases like that. And again, re-emphasizing what I was talking about, the Canadian research on the couples therapy, coping together, not avoiding together, right? So those might be some phrases. Anything that lowers defensiveness, I think, is a good way to start.
Is there, in that conversation, is there one line that actually communicates safety to the PTSD patient, respecting, their traumatized nervous system, as opposed to one line that might accidentally communicate that you're still an ongoing threat?
So things like, help me understand what that felt like, or I can see that your body went into threat. So validating, I can see that you were not yourself in that moment, right? Doesn't excuse what went down.
I want to understand you.
We're on the same team. Just, anything that reduces defensiveness, helps them be seen, speaks to the complexity of what is going on. What you want to avoid is things like, you're overreacting, or we've already talked about this. Those type of statements, just generally, they're just not helpful. I think you've got to start with the assumption people aren't doing this on purpose, right? They're not doing this intentionally.
No one would want to, right?
Yeah, it's kind of beyond their control, right? To a certain degree. So I think, avoiding statements that would shut them down, that feel judgmental, that induce the shame, and then using those phrases that open things up. We're in this together, speak to me. What happened? Open-ended questions,
Are the reactions in those moments by the individuals with PTSD kind of protean and sort of, I won't say cookie cutter, but are they kind of fixed in their spans and in their experiential moment, or do they evolve over time too? And does the caregiver actually need to, through that conversation, keep learning about what their loved ones going through and how the experience changes from time to time? Or is it pretty fixed and once you have an understanding of it, you're good to go?
Like I said before, in my experience of being a psychiatrist and a doctor for over 25 years, human beings are infinitely complex. I don't think anything is pretty fixed. I think it's dynamic, it's moving all the time. We're living in this world. We are constantly being influenced by our environment. Then if you bear in mind the high rate of comorbidity with PTSD, so PTSD goes hand in hand with depression, it goes hand in hand with anxiety disorders, it goes hand in hand with substance abuse. So then when you bring in all those variables that might be contributing to any given picture on any given day, this is complicated, hard work. I don't think we've ever got it down, but I think it's like any other important relationship in your life. Think about being a parent. Who can ever say they've got parenting down? Do you know what I mean? Like the minute you think you've got it down, you're like up and changing again. So I don't want to minimize that. I think that's the richness of human relationships. I think that's what makes it fun. But I would be worried if someone would be rigid. And oftentimes you're not going to see the growth and the flexibility and the change, like I said, without someone getting professional help, And
Yep.
so I think you've got to bear that in mind. I would be really worried if someone was having just the same response day in, day out, not changing or improving in any way.
As you pointed out, we are human and we have our strengths and we have our flaws and we need to acknowledge them. And sometimes the PTSD moment between a recipient and the caregiver just goes awry and it ends badly. Voices go up, someone shuts down, there's an argument, things get said, people get hurt. But sometimes by the next day, things are calmer. And I'd love to know for our listeners, what are some of the things a caregiver can do the next day to sort of re-engage in a repair conversation after the heat of the moment has passed? Because I think it's probably two different approaches. We spoke a little bit earlier about one, but what do you do the next day? What should a caregiver say first?
So, I appreciate this question, and I really think it's important that we are very clear about something. I see this a lot in regular media, in regular pop culture, especially on social media. There is a lot of this, my PTSD made me behave this way, or my anxiety made me do this, which I don't think that type of language is compatible with what a lot of mental health professionals, how we conceive of mental health conditions. When we talk about PTSD, we talk about it as a way to explain behavior. It does not excuse behavior, and it does not excuse harm caused by behavior. And it really makes me sad when I meet couples or dyads or family members who have got into this rhythm where the person with PTSD is basically being allowed to get away with intimidation, threats, emotional degradation, right? In the name of, well, it was my PTSD that made me behave that way. It doesn't work that way. We as human beings, we are accountable for the consequences of our actions. And so that makes me really upset when I see that as a mental health professional, because it's almost like the caregiver has given up their own agency or their own ability. They've misunderstood the job description, right? Like I say, hurt people. It is part of the territory of being a caregiver for someone with PTSD, but it is never okay. So what I would say, if things got messy, if things got nasty, if things got icky, the next day or whenever things have calmed down, I think it's okay to say, I understand you were triggered yesterday, but you need to know I cannot accept being treated that way. It is not okay. Right?
Sounds like relational honesty, right?
What was that?
It sounds like relational honesty.
Yes. And I don't think that happens enough. I do think we, like I say, because of what's going on in the zeitgeist, because of the messages we're getting into, we've almost enabled people who are living with mental health conditions to have behavior excused. But everyone should be held accountable for harming someone else, whether it's with words or actions. Everyone needs to be held accountable for that. The trick with someone who's living with PTSD is to find the right moment to bring it up. But I think it is perfectly acceptable. And the other thing I tell people who are caregiving for people with PTSD, if your safety is compromised, step away, seek some support immediately. If you're in immediate danger, do whatever you have to do to get yourself safe. And the other thing I say is, especially because a lot of people, they're living with children, they're living with dependent people, you are role modeling to those young people what is okay and what is not okay in terms of your own personal safety. So I would love to see a little bit of recalibration. I feel like we've gone the opposite way. I think we've gone from the 1980s where we barely had a word for PTSD and where people with PTSD were ignored and mislabeled and mistreated. And now we've almost like swung the pendulum the other way, where it's almost like it's a way to get out of being held accountable for your own actions.
It's interesting. We hear a lot about trauma-informed care these days, and that can easily fall into that sort of on that slippery slope of that. Well, you can't say anything because it's the trauma that's determining the behaviors, and again, accountability can be lost in the wash. But I think trauma-informed caregiving, that word sort of embraces the accountability that comes with between the recipient and the caregiver. And I would hope that, as you point out, the trauma and the experience doesn't shape the relationship to the point where it becomes an excuse.
Yeah, where it defines it. I mean, I don't know who wins. If a caregiving relationship becomes defined by the PTSD, I don't know who wins in that situation. You know?
So yeah, no, there isn't. You can't assign it that way. I have a follow-up question to a conversation from earlier, but it really keeps popping up on my grid in my head as I'm listening to you, and it's just so topical these days. We hear about the neurochemical effects of social media and short-form video on the brain and dopamine levels, etc. What happens to the neurochemistry or the um, neuronal connections, let's say, in an individual with PTSD who's spending tons of time on social media? Are there added risks there for that individual compared to the general population that we may not understand yet, but may actually have some foreboding that it could even compound and be worse?
So I'm not sure, I can't, off the top of my head, I can't think of any science that has definitively shown this, but I definitely know we know a lot about addiction and dopamine and what happens in the brains of people with PTSD. And I think as a clinician, what I can definitely share with you, what we see day in, day out, all the time, is that with people who are living with PTSD, one of the things they automatically want to do is seek an altered state of some description. Why? Because living in their head is really painful, right?
It's hard, it's
Nightmares,
painful.
the hypervigilance, the memories, it's painful. So they want to seek an altered state. And clinically, we know that predisposes them to addiction. What I've learned from being a clinician and a PTSD expert is that addiction can take any form. Your old-fashioned one was the alcohol, right? The World War II veteran who was, a functional alcoholic for most of their life. They could be a workaholic too, right? There's all sorts of addictions. Food, sex, nicotine, gambling. I have seen it all. And now problematic internet usage because it's reinforcing the same pathways. Where I think it becomes very unhealthy is if you have people who have PTSD and who are living with hypervigilance and they have certain cognitive distortions which make them feel that the world is a dangerous place. When they go online, they can fill themselves to the brim of evidence that supports their cognitive distortion that the world is 100% a fundamentally dangerous place. And I think the load, because of what's accessible, what they can tap into in this age of nonstop digital content, that's what's really scary. It's kind of like, how we live in an obesogenic world, where the whole world is set up to kind of, empty calories, lack of opportunities for exercise. So even the most well-meaning person can gain weight because the society is set up to have you be, it's obesogenic. I think it's the same with PTSD and social media and problematic internet use. The way the digital world is set up is just set up to reinforce your PTSD. And that's really sad. And that's a question I ask people all the time when I meet them for the first time. Like, how many hours are you spending on your phone? How many hours are you spending on your phone when you should be sleeping? How many hours are you spending on your phone where you should be going out in the world and challenging those assumptions? The world is not 100% dangerous 100% of the time. It's not. But if you spend enough time on social media, you will become convinced that it is. I would say even people who don't have PTSD could become convinced. But yeah,
Oh,
there's
for
definitely
sure.
a vulnerability.
I mean, absolutely.
Yeah.
And I think more and more now, people are aware that really it's a good idea to not have a TV in the bedroom and your safe place where you sleep, let alone your phone plugged in on your night table.
Yeah.
I think there's a movement towards really trying to break from that habit.
Yeah.
We talked a little bit earlier about when things go awry and arguments happen and words are said, but you made it very clear that PTSD can explain behaviors, but it can't be used as an excuse for abuse. What happens when that line between sort of symptoms and harm gets crossed? And what should a caregiver do when it goes too far and the first signs of abuse start appearing in the relationship? What does the playbook tell us in that case? Is it any different than any other circumstance, or are they particularly at risk?
Um, I would always say safety first for any individual involved. I think where it becomes complicated is people's definition of what they perceive. Perception is reality. That's a phrase we use all the time. PTSD researchers, trauma clinicians use it all the time. Perception is reality. My perception of what I feel is abusive or what has gone over the line is going to be different to yours. It's going to be different to a third person and fourth person. So that's where I think it becomes complicated. Generally speaking, I think if you feel that line has been crossed, stepping away and giving yourself space has to be the utmost priority. But as you pose that question, I just think it's easier said than done because it depends on where you feel that line is. An objective outsider might be able to tell very clearly, whoa, that was too much. But if you don't perceive it that way, therein lies the dilemma. But I'm always in favor of people prioritizing their own safety first because I just think that's part of a healthy sense of self and a healthy sense of what you feel is the way you want to navigate the world. Maybe another way I would look at it is maybe keeping an eye on basic foundational, like biological variables, like a lot of times that's when I can tell when people are running into problems, when their sleep is starting to suffer, when they're not eating as healthy, when they're not exercising the way they used to. That might be an easy way to tell that you're starting to slip into that territory when those biological variables that we need to just sustain our life and our well-being are being eroded or being ignored.
Or listening to the body and what it's telling us, even in the more primordial ways, the chest tightness, the muscle tightness, the gut grief, and those can often be the first signs too.
Yeah, tension, headaches. Yeah.
I think it attests to the fact that caregivers just often will minimize what happens in those more complex scenarios because they tell themselves, well, it's their PTSD. They didn't mean to do that to me, and it won't happen again. But if we have someone watching today or who's listening out there and who may be realizing that they're actually maybe minimizing harm that they're experiencing, what would be the big reality check that you want them to hear about that can help them move in the right direction?
I think signs of vicarious traumatization that we hinted to before, that's a sign that you're in the danger territory. So if you're living with a baseline elevated anxiety level, if you feel hyper vigilant yourself, irritable, maybe emotionally checked out, that might be another way you're showing up, that you just shut down your emotions because you're so exhausted or because it's so dangerous for you to feel, or you're scared of what you might feel if you don't numb yourself. I think that is a evidence of secondary traumatization or vicarious traumatization, and that is a total signal that you need to get your own support, your own therapy, your own peer group, at least one minimum safe outlet for yourself. You can't co-regulate with somebody if you yourself are dysregulated, you know? So I think those would be some of the signs that it's just too much. And again, just your risk benefit analysis of what you're doing in this relationship. You know, I mean, I've referenced a lot of the couples literature, and I've kind of made an assumption that the caregiver is also in a romantic relationship. But of course, you have children taking care of elderly parents, you have parents taking care of dependent children. So, whatever that dyad is, I do think we have a right as humans to ask ourselves, okay, what are we getting out of this relationship? Why are we here? Why are we caregiving? You know, we're owed something in this too. I think we're allowed to say that, right? I don't think it should be unidirectional. It has to be bidirectional. Why are we showing
I
up for this
agree.
person? What are they giving us? And I think when that balance gets tipped, um, that's when you're set up for all of the mental health consequences of being in an unhealthy caregiving dynamic.
Yeah. And usually harm ensues in some sort of way.
Yes.
Alluding to non-romantic care, or the care recipient not being a romantic partner engaged in a romantic relationship, but there's so many other facets to caregiving with family members. But in your book, you alluded really interestingly to that sort of passive PTSD or partial PTSD, where you retire from life and you have a whole lot of time on your hand, and you referred to that one couple, elderly couple with one individual who had dementia but was lost in a very traumatic state, as they had so much more time on their hands and they kept reliving things that maybe were off the grid because life was so busy until they retired, until they aged. But then all of these memories come to the forefront. And so seniors can have PTSD too, just from life events that were very well buried for most of their life, but never really came to the forefront. Can you comment a little bit about that so our senior caregivers listening can gain a bit of an appreciation of what they might face subtly in certain circumstances?
Yeah, so that incident where you described, we have a name for it. It's called late-onset stress symptomatology. And like you said, very important because we have an aging population. And as you know, even as part of normal aging, and definitely as part of abnormal aging, the brain diminishes in its capacity to retain and form memories. And there is this observation in the geriatric PTSD literature that often what remains are the most prominent memories, right? And as you know, with the way traumatic memories are coded in the brain, they are kind of over consolidated memories. So they remain. So I've heard the story over and again. And again, it is with those certain generations. It may change with subsequent generations because we are so much more comfortable about talking about trauma now. So we're kind of processing it in real time, or at least close to the event. But if you think about it, if you think about people who are octogenarians, people who are nonagenarians, or even in their 70s, who came up in a world where it was not okay to talk about trauma, where you do not admit negative emotions, so you just tuck it away in your head, and no one ever talks about it, and you go about your life. I would argue life was not normal. I would argue that they would have been suffering in many ways, but whatever. You go about your life without being diagnosed. You go out about your life without seeing a mental health professional. And then as you age and your brain's capacity diminishes, what's left is those memories. And then they come out full throttle. And I think there's a lot of caregivers who've been in that position where they might be with an elderly relative who's saying the same story again and again and again and again because they're trying to rework through that age-old memory that is 30 years old, 50 years old. I've heard stories of women who had raised many children, but then in older age, as their memory was slipping, all they could talk about was that one child they lost who died prematurely. That's all they talked about. So again, to me, it's evidence that trauma doesn't go away, right? It remains in some form or another, and it does need to be processed in some way. It doesn't have to be processed via conventional mental health networks. There's many ways trauma can be processed before it becomes PTSD. But to me, these stories of late onset stress symptomatology, these stories of PTSD prevalence in older adults just speaks to why it's so important we talk about trauma and give it a name as soon as possible so that it's not like lying there dormant, waiting to be unleashed, at a later time.
One of the most important books I ever read was Terry Reel's book, I Don't Want to Talk About It. And you can just see how this is the culmination at age 80 and 90 of not having talked about it.
Yep.
Before we wrap up, I just wanted to thank you for the time you spent with us today. I think our listeners have learned so much from all of your ideas and your offerings. To wrap it up, what would be the best way a caregiver can support PTSD recovery without taking on the role of being the home therapist?
So definitely you don't want to be the home therapist, right? There's only so much that a caregiver can do. And sometimes I wonder why people feel they can do way more than that. I mean, like I say, I feel like looking into your own motivations about what you are capable of, you're not capable. Any individual caregiver is not capable of preventing episodes of being triggered. They're not responsible for the trauma, more often than not. I mean, I know there's complicated situations, which we alluded to earlier, but I do think, being the only support system, these are all things that they're not sustainable, So, advocating for a bigger support structure, right? So that you do have longevity in your role, understanding that you have a right to do that, accepting what you can control, accepting what you can't control, making sure the person you're caring for is accountable for their own role, right? I think these are all ways that can help you help your loved one in a healthier way, but also set you up for longevity in the role. But yeah, sorry, I lost my train of thought there. Sorry. Probably.
Good. Well, you can't do it all. You're right. And in a time where we're more isolated than ever, a return to community and that village that got us through everything probably might be the best path to start walking or to actually revisiting. I just wanted to highlight your book. I really enjoyed reading it. If anybody's looking to understand PTSD and the science behind it, but also the different forms it takes and some of the basics that we can embrace to try and look after the individuals we care for, I would certainly highly recommend it. And would like to again thank you for joining us today and look forward to reading more of your work in the future.
Thanks so much, Mark. And can I add one thing?
Sure, absolutely.
If this didn't come through, I just do want to make it really clear to your audience that PTSD is a very treatable condition. With the help of a qualified mental health professional, you can go from, having trauma take over your life, be in the front seat of the car that is your life. But when it's treated, I always tell people it's always going to be there, but at least it will be in the back seat. I just want to emphasize that if it didn't come through, that with the right mental health help, people can be treated with PTSD, and it doesn't have to be a disabling lifelong condition.
And seek that help out early.
Absolutely, 100%.
Wonderful. That wraps up this week's episode of the Caregivers Podcast. Thanks for joining us. We look forward to hearing your comments, your ideas. Please share. It's a dynamic and engaging community, and we're really happy that you're all part of it. We'll see you next week. Before we wrap up, I wanted to remind you of something important. The conversations you hear on this podcast are here to inform, to support, to spark reflection. They're not a substitute for professional medical advice, care, therapy, or crisis services. Listening to this podcast does not create a doctor-patient or caregiver-client relationship between us. If you're facing a medical concern, health challenge, a mental health challenge, or a caregiving situation that needs guidance, I encourage you to reach out to a qualified professional who knows your story. If you're ever in crisis, please don't wait. Call your local emergency number or recognize Centralized Crisis Hotline right away. You deserve real-time help and support. The views you hear on this show, whether from me or my guests, are our own. They don't necessarily reflect any organizations we work with, or are part of, or have worked with, or been part of in the past. This podcast is an independent production. It's not tied to any hospital, university, or healthcare system. Thank you for being here, for listening, and most of all, for taking the time to care for yourself while you continue to care for others. I look forward to hearing from you.